The purpose of the Prostate study, which was set up a long time ago now, was to directly test three major modalities of treatment for localized prostate cancer. And the three modalities were external beam radiotherapy, radical prostatectomy, or deferred local treatment. And bearing in mind that around the time that this was being set up, so we're talking about more than 15 years ago, the terminology around deferred treatment was not quite settled. We're now very clear about what we mean by active surveillance. So the term that was used was active monitoring, which was not the same as watchful waiting. It's also not quite the same as some of the protocols used for active surveillance now, but it is deferred local treatment, external beam radiotherapy, or open radical prostatectomy. And the idea was to invite healthy men for PSA screening. The unique thing about this study was that men were counselled about the uncertainties of treating early prostate cancer and were informed about the randomized trial before they even had a diagnosis. So at the point where they were attending and they were being counselled about having a PSA test. And that's really important, because what that meant was that men could consider the trial, it could consider the uncertainties without all of the body blow that they received if they had just had a diagnosis of cancer. And that made all the difference. So the bottom line was that something like 1,600 men with localized prostate cancer were identified and were randomized three ways between surgery, radiotherapy, or active monitoring. And that was really a unique achievement in this field.